Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. The study I'm citing today was published in the journal Canadian Family Physician on March 1st, 2017, and it deals with the diagnosis of high blood pressure in Canada. Now, the researchers of the study concluded that 20% of people receiving treatment for high blood pressure, also known as hypertension, don't actually have the problem and don't need the medication that's been prescribed. So this is due mainly to the fact that their blood pressure was improperly measured, according to the lead author of the study, Janusz Kazarowski. So the study was conducted by researchers at the University of Montreal Hospital Research Centre, which showed that more than half of family doctors in Canada are still using manual devices to measure blood pressure, a dated technology that often leads to misdiagnosis. So the traditional way to measure blood pressure was done manually using a sphygmomanometer and a stethoscope. So here's my stethoscope. This is the way I was taught to take blood pressure. And this is my sphig right here, which has the blood pressure cuff and then the little pump with the meter reading on it. And this is the way back in the 1970s I was taught to take blood pressure, and this was what was available at the time. But we're seeing that this way of taking blood pressure is not really the most ideal. So over the past 20 years, automatic electronic measuring devices known as oscillometric devices have become available, and studies show that they produce more accurate readings than the manual method. In 2016, the Canadian Hypertension Education Program guidelines recommended that electronic measurement is preferable to manual measurement. So the 2017 study showed that 52% of Canadian family doctors still use the manual method of blood pressure assessment, while only 43% have switched to the automatic devices. Now, the automatic devices are more expensive, but they're more precise because they take several measurements and they eliminate what's known as white coat syndrome, which refers to artificially high blood pressure resulting from the stress of being in a doctor's office and human interaction. In other words, the stress of having your blood pressure taken manually for some people can cause a burst of activity in your nervous system that causes your heart to contract with more force and the muscular walls around your blood vessels to tighten, which in turn elevate both your systolic and your diastolic pressure. So your systolic pressure, which is the first reading, is how hard your heart is contracting. And the diastolic pressure, the second number, is a measure of how much resistance there is to the flow of blood in your arteries. As a result, it's easy for high blood pressure to be overdiagnosed using the manual method of blood pressure assessment. However, the manual measurement is acceptable if it's done properly, but that's often not the case. So to take manual blood pressure the right way, a 12 to 15 minute period is required, so the patient can be left alone in a room and in a relaxed position. Now, we know that the average visit to a family doctor is 10 minutes. So the patient is often still a bit in a stressed state or an anxious state when the blood pressure is taken, without having ample opportunity to compose themselves and get sufficiently relaxed before the measurement is taken. Now, in addition, the Canadian Hypertension Guidelines state that modifying health-related behaviors is an efficient way of preventing and treating high blood pressure and reducing the risk of cardiovascular disease. What they say is that it's possible to lower blood pressure through healthy diet, regular physical activity, moderate alcohol consumption, reduced intake of dietary sodium, avoidance of exposure to tobacco products, and stress management. Now, in Canada, 1 in 5 adults suffers from high blood pressure, which represents the greatest global risk factor for death and disability. High blood pressure, let's be clear on this, is the greatest risk factor for death and disability worldwide, including Canada. In Canada, healthcare costs attributable to high blood pressure was more than $13 billion in 2010. So in summary, there are several things that you should act on. Number one, get your blood pressure assessed. Make sure that it's under 140/90, more ideally under 130/80, most optimally under 120/70. If possible, get your blood pressure taken from a physician using an automatic device, an automated device. If your physician is still using the manual method, then insist that they provide a quiet place within their office where you can sit or lie down and become fully relaxed for 12 to 15 minutes prior to your blood pressure being taken, to avoid a misdiagnosis and the delivery or recommendation or prescription of any unnecessary treatment, including medication. If your blood pressure is high, then adhere to the medication prescribed to lower your blood pressure, as high blood pressure is a cardinal risk factor for stroke, heart attack, and chronic kidney disease. You cannot walk around with high blood pressure without it catching up with you at some point. And if your blood pressure is high, then review and act on the dietary, exercise, and other lifestyle measures shown to help lower blood pressure. In many cases, acting on these strategies will enable your physician to lower the dosage of your medication, which reduces drug side effects, or eliminate the need for medication altogether. The World Health Organization states that 75% of high blood pressure cases are in the mild to moderate range, whereby lifestyle modification alone can reduce blood pressure to normal in a high percentage of cases. So I've included a link to the research paper below. Thanks for watching. I'll see you next time.